Minutes to the top of the hour here on the program. Today, the South African development community commemorates Malaria Day. The focus is to persuade the public to participate in programs intended to control the disease. According to the World Health Organization, in 2015, there were roughly 212 malaria, should I say that again? 212 million malaria cases and an estimated 429,000 deaths. Professor Lucille Blumberg, Deputy Director of the National Institute for Communicable Diseases, joins us here in studio. Prof, it's always great to see you.
Thank you very much.
Goodness me, I mean, these figures are, that's 2015 we're quoting right now. How are we doing? How is the SADC region doing in trying to bring this figure down?
Well, those are huge numbers, but compared to the year 2000, number of deaths have actually halved. So there have been a lot of interventions, but we can't lose the momentum, and we cannot take resources away. Malaria is very unforgiving if you kind of stop because you have some sort of success.
Yeah. So you're saying that these figures have actually halved since they were last reported. I mean, that's a great victory. It really is, and yet it's still so big.
Yeah.
Let's talk about some of the things that were put in place to halve it.
So I think control programs, giving nets to populations, not in South Africa, but in the very high malaria transmission areas, nets for people to sleep under, to protect them against mosquito bites, the use of highly effective, what they call combination therapy, using a drug called artemisinin from China. That rollout, I think, has been very successful, and that has really led to some successes.
Yeah.
But we're seeing a lot of malaria this year.
Yeah. We really are, and we're hearing it in areas that you don't necessarily hear of malaria. Is the spread or our infectious areas getting bigger and bigger and wider?
In fact, in South Africa, it's the traditional malaria areas that are affected, and the areas where historically we saw malaria. So these are not new areas. We're epidemic prone. They call us an epidemic prone country, one of several in Southern Africa. So we don't have stable transmission, and every few years we do get a peak.
Yeah.
Weather has been very conducive, high rainfall, high humidity, temperatures, and there have been some cutbacks on the malaria program, probably because of some successes, areas where malaria wasn't seen. You tend to cut back on your spraying program. Resources are limited.
Yeah,
but
and
this year has been a late peak,
a high one.
A winter where the mosquitoes were really quite happy to breed because of warm temperatures, and really a very early surge.
So, but even cases in sort of the north of Pretoria. Now
so those are unusual.
Okay, so that's where I'm referring to. Talk
we're
to me
not
about
seeing local transmission there. Every year we do get travelling mosquitoes. These are mosquitoes that might be infected, that hop a lift in a taxi or an aeroplane or a motor vehicle, get into a suitcase and survive the journey. Most don't. Yeah. And then bite someone at their destination.
Okay.
So we see 5 or 6 of these a year. We investigate all of them, and we've not found any local transmission in Pretoria or other areas.
So let's talk about preventative measures, because we know it's there, we know that there's a surge, we know that the risk is higher this year. What do you need to do?
So I think part of the SADC Malaria Day and event, it's actually a SADC Malaria Week, is to raise awareness, to make communities aware of the symptoms, the headache, the fever, the flu-like symptoms, and to seek urgent medical care. If you're living in an area and you develop flu or fever, it's not flu, or you've travelled recently in a malaria area, it's malaria till disproved.
Yeah.
Have to have a blood test, needs to be done urgently. Malaria is treacherous, progresses in a few days, and there's treated early, malaria responds very well to treatment.
When do you start feeling those symptoms, though? Because, you may come back and maybe 3 weeks later you start getting the flu and you've actually forgotten you took that trip.
So I think within a month of travel or being in an area,
be vigilant,
or just living in a malaria area. There actually is no flu at the moment. The flu season is gone, and the biggest mistake is people say, I've got flu and malaria is missed.
There you go.
Yeah.
The other, obviously, is taking preventative medication.
Yes.
And a lot of people don't necessarily like taking them.
Yeah.
But obviously you advocate for people that are going to a malaria area, take the medication.
Yes. I think people going to Mozambique, our surrounding countries, low-felt areas of Mpumalanga, Limpopo, Kruger National Park as well, and surrounds, prevent mosquito bites, apply repellent when the sun goes down, wear some long pants and socks. I know it's hot. And I think if you can, take medication to prevent malaria.
Yeah, I've heard gin and tonic helps. Does that help?
You're going to have to drink a lot of tonic water. No.
Okay, all right. So that was a myth there, but still enjoy a gin and tonic in the bush if you can. Lucille, we've obviously, we have come a far way, but we still have a very long way to go. Now, I'm talking about people that are going there on holiday, but what about people that are living in these areas?
Yes, so there are very good programs. In fact, South Africa pioneered what we call indoor spraying of houses to deal with the mosquitoes that go indoors, feed on people, rest on the walls, and to kill those. These are long-acting insecticides. The teams are out there spraying. They've been doing this annually for many years. I think the spraying program has started in the last few weeks, and the cases are going down. But it's when you sit outside. So that's where you need some extra protection from mosquito repellent.
Yeah.
Some people might use nets. It's not part of the national program, but it is used as part of a program in many other countries.
Yeah.
So there are many ways that you can protect against mosquito bites.
And yet,
early treatment.
That's the big thing.
Don't mistake flu for malaria.
We still live in a time where we hope to see this completely eliminated. I don't know. Will this happen in our lifetime?
We're aiming for malaria elimination in 4 countries in southern Africa. That means no local transmission. Mosquitoes are still there, but there won't be locally acquired malaria. We'll still see imported cases. Swaziland is doing very well. KwaZulu-Natal is doing very well with the elimination program. Limpopo is needing some work. Mpumalanga, and then we're working together with a number of our countries around us to deal with cross-border issues and reduce transmission.
I need to talk about something as well that's gotten a lot of people very, very worried, and that, of course, is the bubonic plague.
Yeah.
Obviously, we know we're talking Malaria Day, but the bubonic plague that's happening in Madagascar it's frightening. I mean, we've gotten 124 deaths so far, well into the thousands of people that are being affected. And the World Health Organization has actually named South Africa as one of those that need to be alert and high alert for this. Talk to me more about this.
So plague occurs every year in Madagascar. It's usually the Central Plateau. They have a season which starts September, October. What's different this year, it was earlier. We're seeing a lot of pneumonic plague cases. That's more easily transmittable between people, and it's moved into the cities. However, the numbers of cases are starting to go down. There are many districts that haven't reported cases for the last 2 weeks. Plague is treatable with easily available antibiotics. And in the 4 months that the outbreak has been occurring, there have been no cases in countries surrounding us. So I think the risks in South Africa, in countries that have close association with Madagascar, we need to be alert. But, we haven't seen any cases.
We haven't seen anything happening here.
And we're not expecting to.
Finally, I mean, what would you look out for? I mean, if you have visited Madagascar, obviously you must take precautions. What are those precautions?
Yeah, I think it's to protect against flea bites, so the same insecticides, to avoid crowded areas. I think the risk to tourists and visitors would be quite low. And it's really, if you've been to Madagascar and you develop fever, it's probably malaria. So take your malaria prevention so there's no confusion, and let your health practitioner know that you've been to Madagascar.
Okay. All right. Lucille, thank you so much for talking to us here on the program. It really is a pleasure speaking to you. Lucille Blumberg is the Deputy Director of the National Institute for Communicable Diseases, talking to us about the SADC commemorating Malaria Day. It's Malaria Awareness Week this week, and also touching on the bubonic plague that a lot of people have been speaking about. All right. After the break, we're going to be talking